We're here with Elaine. Elaine, can you tell us a little bit about what is MRSA?
MRSA is an abbreviation used in healthcare industry and at St. Joseph's Healthcare London in reference to methicillin-resistant Staphylococcus aureus. It's a bacteria, Roy, that people carry on their body and is very resistant to any antibiotics.
Okay. So if a patient gets MRSA, what's the impact on them?
Well, for some people, the impact, they would never know that they actually are carrying the bacteria. They can have no symptoms and no signs related to any infection. But for others, they will develop an infection and we will need to treat that infection with antibiotics. It also makes a difference if you're in hospital. So if you're in hospital and someone comes to see you, they may need to gown or glove when they come into your room. You may be put in a private room and you may be asked to stay in your room so that you don't spread MRSA to other patients. Parkwood is really working on developing a culture of safety for all of our patients and all of our staff. And so what we are targeting is 4 cases or less per month at Parkwood of MRSA. So we have many strategies. One of the strongest one, the most predominant one, is hand washing, because we know from the literature that that is what makes the most significant difference. So we have put in place infection safety champions in each of the programs in order to coach our staff, to coach family, visitors, physicians on hand washing. We've worked with environmental services to ensure that our area, our whole hospital, is clean and free of bacteria. We actually worked with environmental services to get new curtains so that they could be washed on a more frequent basis.
Okay. And I know hand hygiene is something that's been a focus for at least the past year or so. Have we seen some of our rates improve over the last year?
We certainly have.
What are some of the things that patients and families can do to protect themselves?
Well, patients and families need to do the same things that our staff do. They need to wash their hands thoroughly whenever they enter the patient's room, whenever they leave the room, and if they touch anything in the room when they're with their loved one. They also need to be aware that putting their feet on the bed creates a problem because linens can frequently have the bacteria on them. And finally, our visitors and family members frequently will assist other people within their room. And it's really important, if they're going to do that, that they wash their hands before they leave their loved one's care area, that they wash their hands before they enter into the other person's care area, assist them if it's even handing them the newspaper, and then when they leave that care area, they need to wash their hands as well.
If a patient or a family member observed a staff member who had forgotten to wash their hands, what should they do?
Oh, I would encourage them to speak up and to say to their caregiver, I didn't see you wash your hands. Would you please wash them? I want to make sure that my loved one stays safe. It's a very important strategy.
All right. Thanks, Elaine.